Good morning. My name is Dottie Gallagher. I'm the president and CEO of the Buffalo Niagara Partnership. Welcome to session number 2 of our Preparing Your Business for COVID-19 Vaccine series presented by Highmark Blue Cross Blue Shield. Today's session will focus on creating an effective and inclusive vaccine policy and plan for your organization. We thank our presenting sponsor, Highmark Blue Cross Blue Shield, for helping us bring this important conversation to our business community. We'll start today's session with some stark reality. The COVID-19 pandemic is far from over. In fact, our region is moving in the wrong direction. According to the New York State Department of Health, more than 118,000 Western New Yorkers have contracted COVID-19 since March 2020, and more than 2,300 have died from it. Earlier this year, our region was making progress with declining cases, hospitalizations, and deaths. The trends have changed. Even as the vaccination effort ramps up, positive cases and hospitalizations have increased significantly in recent weeks, with an average daily caseload rising to its highest level since early February. There is a little bright lining in this, and that is that there is nobody who is hospitalized who has completed the vaccine regimen. The COVID-19 pandemic has already tested our region, our country, and the entire global community in unprecedented ways. And getting back to a more familiar life here in our region, back to seeing our loved ones, back to school, and back to business requires that we eradicate COVID-19 through an efficient and coordinated regional vaccination strategy. We know that COVID-19 vaccines save lives, and we can return to a greater sense of normalcy in our daily life. And we also know, given the increase in positive cases and hospitalizations in recent weeks, that the business community and individual employers have the opportunity to lead in Buffalo Niagara's vaccine effort. The Buffalo Niagara Partnership remains committed to sharing trusted information about COVID-19 vaccines with the business community in consultation with our local government entities, New York State, the CDC, the U.S. Department of Health and Human Services, the U.S. Chamber of Commerce, and the Health Action Alliance. In total, this series was really designed to help employers create a clear COVID-19 vaccination policy for employees, part-time workers, temporary workers, and contractors that encourages vaccination, reduces barriers, and makes it easier for people to get vaccinated when it's their turn. Communicating with employees, workers, and customers about the safety and benefits of COVID-19 vaccines, and reinforcing the importance of masking and social distancing to prevent the spread. We want to help you create a safe workplace culture where all workers feel supported, and we are working hard to strengthen vaccination efforts in the regional community. Last week, we were joined by health and legal experts to discuss efficacy and the safety of the FDA-approved vaccines and associated human resource issues. Today, we'll discuss how to best create a vaccine policy and plan that engages all of your stakeholders and gets shots in the most arms possible. On April 30th, we'll talk about how each company's vaccination plan must include a thoughtful education and communication plan to be successful. All of this effort to date has been informed through research that we have been doing ourselves from leading sources, and we're happy to share that with you. In fact, we encourage everyone to visit the partnership.org event page to register for the last in the series, and to look at our COVID-19 resources and impacts page for updated information on vaccine access and some samples on education policy and communication, and of course, our other upcoming events. And if you need specific guidance or assistance, you can use the BNP business link on our homepage to ask any question, and our team of experts will contact you with a response. While you're on our website, we encourage everyone to take a look at the wide range of our other upcoming events, including our 30th annual, hard to believe, 30 years, our annual Athena Awards, which will happen on April 28th. The Athena Awards is the region's most prestigious event, recognizing the professional accomplishments of exceptional individuals and organizations dedicated to the advancement of women. Today, we're fortunate to be joined by Glenn Scott, Vice President of Human Resources for U.S. and Canada Manufacturing at Rich Products. Glenn brings over 20 years of human resources and leadership experience to our session. Rich Products is a regional, national, and international business leader with over 11,000 employees worldwide, and Glenn will share how Rich is creating its own vaccine policy and plan and communicating it throughout their global workforce. We will close the meeting with a Q&A session as time allows. You'll see the Q&A button at the bottom of your screen. Please type your questions there. And if you see an already asked question that's of interest to you, please hit the like button so it will rise to the top of the list. We do ask that you enter your name in the required fields if you are asking a question. We will not address questions that have anonymous sources. We will also be sharing an event survey that only takes a moment to complete, as we value your feedback. Before we discuss the best steps for creating a vaccine policy and plan, let's go over the important questions that we frequently hear from employers. These answers are supported by the U.S. Equal Employment Opportunity Commission as well. Can employers mandate vaccination? Yes. Our goal is to help create vaccination plans that yield voluntary appointments, but employers can legally require employees to get vaccinated with two very important exceptions: a religious objection and/or medical condition. I will tell you, in my experience to date, we haven't really found many employers that want to mandate vaccines. Can employers ask for proof of vaccination? Yes. Please keep in mind that when you are asking for this verification, employers citing the allowable exceptions are entitled to confidentiality. Can employers ask for advance notice of vaccination appointments for scheduling purposes? Yes. Employers are still responsible for scheduling the workforce and are legally permitted to ask advance notice of these appointments. Per the New York State COVID-19 vaccination leave law, do employers need to provide 4 hours of paid leave for each vaccination appointment? The answer is yes. The state's vaccination leave law is effective until at least the end of the calendar year and provides 4 hours of leave for each vaccination appointment for every employee, both full-time and part-time. Are appointments scheduled on weekends or after work hours covered by the law? The answer to that question is no. The state law only applies to appointments made during an employee's scheduled workday or shift. Are some employers eligible for a federal tax credit associated with this paid leave? Yes. Businesses and tax-exempt organizations with fewer than 500 employees can receive a FICA tax credit or providing paid time off for each employee receiving the vaccine and for any time needed to recover from the vaccine side effects. Is there employer liability associated with on-site vaccination? No. If we are presuming a voluntary vaccination on your site, individuals getting vaccinated are completing consent forms, and the employer itself is not administering the vaccine, any additional liability is unlikely. Staying with the topic of on-site vaccination, BNP is helping facilitate on-site vaccine points of distribution, or pods as they're called, for employers that are interested. This week, we launched a vaccination clinic interest form for businesses that are considering becoming a point of distribution or pod. The BNP is working closely with government entities and regional pharmacies to help create these opportunities. Please visit the partnership.org and click on the icon you see here on the slide to complete the form. Employers that host either a government or pharmacy-sponsored pod do need to meet specific guidelines. For example, this slide shows what the Erie County Department of Health requires its pod partners. The county provides both dosages of vaccine, staff to administer them, and a site evaluation. The partner site must guarantee at least 50 people for vaccination, support scheduling, provide staff to monitor the pod, and specific waiting and work areas. In addition to the pods, the Buffalo Niagara businesses can strengthen and accelerate the region's vaccine response by creating and executing a vaccine policy and plan. The steps I will discuss now, recommended by the Health Action Alliance, and supporting documentation and templates can be found in the Vaccine and Testing section of BNP's COVID-19 Resources and Impacts page. So what are you to do? Step 1, designate a coordinator or create a task force. A written COVID-19 vaccine policy and a workforce vaccination plan can organize all of your company's efforts with a dedicated person or team to create the plan and execute it, working collaboratively with stakeholders across your enterprise. Much alike with facility safety protocols, human resources, and employee wellness, designating staff time to vaccination planning is a way to ensure that the work gets done. The COVID-19 Plan Coordinator or Task Force can convene stakeholders, share current information about vaccination opportunities, gather feedback, oversee communication, and engage employees from disproportionately impacted communities. Step 2 is to proactively engage employee populations who may have unique needs, concerns, or questions. As always, communication is key. In developing your plan, proactively engage employee populations that may have unique needs, concerns, or questions about the COVID-19 vaccines. This isn't about convincing workers to trust the vaccine. It's about understanding their perspectives and concerns and working together to identify solutions. Minorities have been disproportionately impacted by COVID-19 and have experienced higher rates of hospitalization, severe illness, and death. If you're not a member of these population groups, start by learning more about why these inequities exist and how they might contribute to additional questions about vaccines. Invite leaders within your workforce to participate in your company's COVID-19 vaccine task force and meaningfully contribute to developing your company's vaccine plan. Organizing listening sessions with communities of color and other employee networks to make sure all interests are heard and develop plans will help you develop plans that meet your community's needs. The third step is drafting your company's policy. Each company has decisions to make on how to communicate about COVID-19 and encourage vaccination. Some employers will add potential incentives or requirements. All employers should focus on ways that its leadership team can remove as many barriers to vaccination as possible. The company's decisions about its approach to vaccination should ultimately be formalized in a policy so that everyone understands the expectations and opportunities. Once this policy is completed, it's just as important the company continues to encourage the use of approved masks and social distancing in accordance to state and CDC guidance. Now that we have reviewed recommended steps, we have the opportunity to learn from an industry leader that is putting these steps into action. We are joined by Glenn Scott, Vice President of Human Resources, US and Canada Manufacturing for Rich Products. Glenn is going to discuss how the Rich Products team has approached vaccine planning, policy, and encouragement. Thank you, Glenn. I'll now turn it over to Glenn for his remarks. Welcome.
Thank you, Dottie, and good morning, everyone. Can you hear me okay?
We can hear you.
Okay, good. I'll take that as a yes. Well, good morning, everyone. As Dottie and the team mentioned, the honor of leading our HR and talent team for North America. So we have about 30 sites that represents from New York to California. And what's showing on screen now is really the output of the work we've done over the past few months in terms of communicating and educating and opening a dialogue with our associates about this topic. So this is actually a screenshot of our internal website. As you can see, playing on our name, we call it the Enrich Cafe. And there's a number of links and resources, as you can see here. But why don't I move on and just sort of go back to, let's call it mid-February, when we had 2 vaccines on the market with a third being approved. So one of the things, Dottie, I think you teeing up this topic was excellent because, to start with, we do not mandate vaccines. That is not our family approach because we do consider our associates coast to coast as part of our extended family. But we also want to keep them safe. So one of the other points I'll make is while vaccine adoption is certainly a priority for us and will continue to be so, it's not the only part of our safety plan. As you might imagine, 13 months ago when all of this started in the food industry and in essential business and operating in about 14 different states, we had a lot of conversations with our team on how to safely make product. So Carvel ice cream cakes, for real milkshakes, farm-rich appetizers are all things we make. And we also had to communicate with our customers and our consumers. So when the vaccines became available, I believe it was starting in December, we opened conversations with our HR team and our broader team, so communications, legal, and of course my team in HR to say, how can we educate? How can we provide access to vaccines? And how can we encourage people who choose to take the vaccine to be able to take it? It's hard to believe here sitting in late April that many states now have almost unlimited vaccine appointments. As recently as 4 weeks ago, access was still a major issue in many of our plant locations. But I think, starting with education, so I will say, I am an HR person. I am not a medical person, nor would I play one on TV. So we partnered with the Cleveland Clinic and a lot of trusted advisors there, as well as the US CDC and the Canadian equivalent, to provide information to employees. And, that information continues to evolve. I know we've all probably followed the J&J vaccine pause over the last couple of weeks, but whether it's, I'll call it positive news or even unknown news in the J&J case, we continue to use expert resources, to your point, Dottie, and to make sure that associates have the information they need to make what, at the end of the day, is a very personal choice. We've hosted a number of forums where our communications team facilitates, but we ask and answer some pretty open questions of the experts. So I think that's been one element of our strategy is, again, recognizing it's a personal decision, what education is out there broadly, and obviously any personal situations would have to be answered by the person's medical provider. The second thing is access. So again, that is probably not as much of a problem in the US, but for our friends in Canada, access to vaccine is still quite the challenge. I know our Fort Erie site right across the border recently was able to get some vaccine appointments, but it's been the result of 4 months of trying by the plant leadership there. But I will say, vaccine distribution, and even if there are future shots like booster shots, it continues to be governed by local health officials. So I know in the California community, we partnered with the local health department in Southern California, LA County, as well as Fresno County to get vaccine appointments. We've also looked at bringing vaccine clinics on site where we could, but access both in terms of supply and demand has been a challenge. So I would say the third leg from an incentive perspective, Dottie, I think you had a couple of comments in that area. We recognize that many of our associates have challenges with transportation, or at least having their own transportation, as well as flexibility for appointments around their work schedule. So one of the things that we've done over the past month is we provided 2 distinct incentives to help, as I say, make people whole, where they're not having to choose between going to work to earn money or taking the vaccine. And again, with the vaccine availability now, that's less of a challenge, but we still have kept the incentives. One is paid time off, or I would say additional paid time off, where depending on which vaccine regimen you're on, we offer 2 hours of additional PTO to account for the time to go to the vaccine site. And if they come back to work to choose to come back, they can also get those 2 hours on the weekends if they're not working, if that fits their schedule better. So I think, again, trying to balance the need to be off or to perhaps deal with side effects rather than to have to come to work. The second piece is we are offering, I would say, incentives in the terms of a small payroll increase for completing a vaccine series, or we have a wellness program with Virgin Pulse where we offer incentives that ultimately end up in credits back to the employee for their healthcare premiums. So I think the thing I'll start to close with is we continue to listen because, again, we're not healthcare experts either, but given we're an essential business in an often sort of enclosed plant environment, we work with our safety resources to make sure the environment itself continues to be safe, regardless of whether someone chooses to take the vaccine. In fact, I can tell you, sometimes people, I think HR folks have infinite knowledge. I do not know who has and hasn't taken the vaccine in our sites, but we have the same safety protocols. So temperature checks every day, a questionnaire in terms of symptoms, and if someone does have positive symptoms, making sure they have the resources at the site to determine whether or not they can come on site that day. We offer catastrophe pay, or CAT pay as we call it. So again, if someone is showing symptoms and we jointly determine they can't come to work, they're not out money. They're able to go home and recover. So I think in terms of what I can help influence from a policy perspective, we've done quite a bit, but we also continue to listen. And there are certainly many different opinions, as you know, on this topic. But again, if someone chooses to take the vaccine, we offer the incentives. Dottie, you had mentioned 2 forms of reasonable accommodation as well, both for religious or medical reasons. And we do have a reasonable accommodation for people who do claim either of those 2, where they can complete an education series in terms of, if I can't take the vaccine, how can I still protect myself, my associates, and my family? So it's been quite well received with our population, I would say. And, as we all are, we'll continue to monitor the situation as more medical science is known. So in a nutshell, that's what we've done at Enrich Products. So back to you, Dottie.
Well, thank you, Glenn. So help me understand. So the incentives that you have when people complete the regimen, how I guess I'm wondering, when you say you don't know, when you say you don't know who's vaccinated, who's not vaccinated,
Mhm.
doesn't that sort of reveal who's been vaccinated, who's not been vaccinated? If
Yeah,
they are,
so I could find out if I really wanted to,
I got it.
but what we do, because this gets where we have to balance privacy with HIPAA versus the reality of if someone's claiming an incentive, because someone could take the vaccine and choose not to take any of the incentives, right? So if they want complete confidentiality and anonymity, that would be the way. Obviously, if they claim an incentive, the confidentiality is less because HR and their one-up supervisor needs to see proof that they've taken the vaccine because that's how we track internally the adoption rate. So,
well, that's sort of where I was going. Yeah.
Yeah.
So okay.
Yeah. No, it's a good question. So the way we've chosen to deal with it is we do not want copies of vaccine cards because we feel like that crosses the line just with our own policies. But we just ask the associate if they're scheduling an appointment during work hours to show us that appointment so that we can pull in someone to cover their part of the shift. And when they finished each vaccine, they just show the card. Or like in my case, since I'm remote, I showed it to my manager on video just to see that the vaccine had been taken. And then once they complete, in this case, the second dose, their manager can approve whichever incentive they choose, whether it's we're offering $100 through payroll, or again 300 wellness points, which can help them get to the rebates and premiums for the following year. So, as much as possible, the anonymity will somewhat go away, but we've really coached our supervisors to say, as they come to us, again, we do not in any way create second-class citizens because there's many opinions on this topic, but we do need to know who's taken it for adoption and incentives. So I feel like we've balanced it pretty well, but I'm always open to other ideas.
Well, it sounds like, well, obviously you've thought this through, and Enrich Products is a leading employer in every way, and we're not surprised that you've thought through. And I think for Rich Products, the impact of the pandemic on your company started earlier than because you all are in China, you're all over the world, so you sort of saw it coming when all of us are trying to figure out what's coming, right? So it's great that you've had such a thoughtful approach. Can you tell, Glenn, or are you seeing the same levels of hesitancy that are in the general population, or have these efforts, do you think, have they accrued to your benefit? In other words, do you have a higher adoption rate than we see what's out in the public right now?
Sure. Well, just because I would say it's been very recent that people have had access to many of our sites. I think in the New York area, certainly we've seen a high adoption. States like, Tennessee, Georgia, Texas, just from a supply perspective, have only recently been able to schedule enough appointments, and we have seen people go through the whole series. So I think, the direct answer is we have not seen the same adoption yet, but it seems week to week to be going up. So I think if we had the same conversation in 3 or 4 weeks, we would probably see a higher adoption rate in those areas as well.
Well, that's super interesting, and I think you're bringing in the medical experts to really help you is so important. I mean, so Glenn, I'm on the Regional Vaccine Distribution Committee for the 5-county region, representing employers in Erie County, basically. And it is interesting, sort of demographic by demographic, and even geographically, how there is adoption, yes or no. So in Erie County, and these numbers are from last week, I know because I live in Amherst. Amherst had among the highest level of vaccination. 40% of the people are vaccinated. In some of the southern tier counties, the vaccination rates were as low as 11%. Within the city of Buffalo, there are some zip codes that are only at 4%. So it is really sort of it's a block and tackle sort of approach around how people are feeling about the vaccine and how much information they have. I think, I think there's, to some degree, there's so much information out there and misinformation out there. Employers can play a really good role in helping their employees navigate sort of the legitimate health information that they need to make those decisions. So it sounds like you've really, threaded the needle there. So people listening, when we talk about the recommendations that we put forth, which, by the way, we aren't experts either. We've accumulated a lot of research on behalf of our employers, and that's the leading research as of the moment. This notion of infrastructure, how do you manage that at Riches? Do you have someone in every plant? Is it a corporate organization? Tell me about how you manage that.
Sure. So again, my particular organization is mostly hourly associates in our sites. We have about 30 production sites. And of course, as you know, in Buffalo, we also have some seasonal workers with the Bisons. So the way we managed it is we look at this in particular as it's leader-led, meaning supervisors, managers, those who spend the most time with their associates, but HR-enabled, meaning I need to help eliminate or reduce barriers, in this case, to getting the vaccine. So we spend a lot of time in conversations with our leader network because what I have seen is there's a population that I think the medical advice is helpful. I would say there's probably a silent middle that may not have made up their minds yet on the vaccine because, again, it's a very personal decision. So with our leader network, we continue to connect to the experts, but we also listen to them on a local level around what a barrier may be or a concern. And again, I certainly can't resolve all personal concerns about whether either to take it or to not take it. But rather than it being an HR-driven thing, I think in this case, a lot of the conversations on our operating teams, again, we operate plants 24/7. So when concerns come up that the team leader hears, he or she can come to us, for access to the medical people, or just what are you seeing in other plants, Glenn? Do people have this concern? And then relaying that information back, but again, letting people make their own decisions about whether or not to take it. I think for us, given the size of our organization, taking it down to the local team level has probably been most effective versus just having this unknown
Top
voice
down,
in corporate.
Right.
Throwing things at them. That's not at all what we want to do.
Well, it's interesting because we're studying a lot. I say we, the regional committee, and I, with Dick Lipsitz from the AFL-CIO, chaired the education subcommittee, like to really think about, how can various populations deal with vaccine hesitancy? What does the research say? And if you were to look across all the targeted, not only minority communities, but people in the rural communities, young people, like all of these sort of demographics, and say, what is the barrier, or whether perceived or real barrier there, what cuts across all of those gets to exactly what you're saying, is the only way someone who is vaccine hesitant gets to feel comfortable if they choose to get the vaccine is they are talking to somebody who they trust, right? Whether it's their doctor, their faith leader, or their employer, because that sort of vetted information and that trust relationship is just super, super important. And I think employers need to understand that they really do play a role beyond what's obvious in this effort as we move forward, because there is so much confusion and myths and a genuine choice people need to make one way or the other. So we've got a couple questions, Glenn, and I would encourage folks on the call, if you've got questions, to put them in the Q&A. And this first question is from Deanne Switek, who's with Synergy IT Solutions. She wants to know, what educational program did you use for those who need an accommodation for the incentive?
Yeah, so we actually pulled from both the CDC and I believe it was the state of New York Health Department. We have a learning and development team that put it together. But it was a series of short videos that just said, again, if for whatever reason you can't or choose not to take the vaccine, again, thinking of a plant environment, how can you have protection for yourself? And it goes beyond just wearing a mask, but many of our associates choose to carpool or take public transportation to work. So just reinforcing that, really, Dottie, the last thing I want to see is someone leaving our front gate and then immediately taking off their mask. Again, that once they leave our property, that's a personal choice, but just reinforcing what we've all heard, but always wearing a mask. So even though I've completed a vaccine protocol, when I leave my house, I still social distance, I still wear a mask, I still sanitize my hands frequently. And, if I need to get together with my family, I'm choosing to do it outside. With the snow this week, probably many can't, but just it's the basic things. So just reinforcing, I'll call, in your activities of daily living outside the site, particularly if you live with a family member who may be immune compromised, like one of my parents is, just reinforcing practical ways to protect without being distant as much as possible. So again, following, just to answer the question, just like we did with the CDC and the Cleveland Clinic. The Cleveland Clinic actually hosted a few virtual sessions where people could be on the session live and just like we're doing, have comments. But we also pulled any videos from those sources because again, we're not the medical experts in this area. So we wanted people who were choosing, or at least at this point, can't take the vaccine, to have some solid information. Again, as I said, the vaccine alone is not our only strategy.
Right.
Even downtown Buffalo, our world headquarters, sadly, it's been mostly vacant for the past year. But as we start looking at people coming back to it, how do we do so safely? Because we'll still wear masks, we'll still distance. How do I use a conference room? I'm sure many employers are looking at that, but we're using the medical experts to help guide us to what is the maximum number of people that can be in an area. Because for the past year, we've had to do that in our sites, restrict how many people can be in a conference room,
Right.
or other places in the plant. So that, for us, we're pulling on trusted sources that don't have a viewpoint other than a medical viewpoint.
Yeah. So, to that end, and for the people who are listening, our partner Highmark and also our member Univera, both, we have on our website right now that you can download prepared myth busting Q&As and educational materials that you can download. Again, as I said, from a variety of sources. We also have links to very well researched communication. What kind of and we're going to talk about this next week. What kind of communication will resonate versus what will not resonate? But as many samples of this research that we have vetted that we feel will be helpful are on the website right now that you can pull down and read yourself, that are really directed to the employer community in terms of our role in this. So that's great. So I don't see any more questions in the chat. You did such a good job, Glenn. I don't, you've left them all, answered. So I'll just give a last call here for any last questions that you all have. Okay, hang on. Whoops. Let me just make sure I got this right. I think we're good. Awesome. Okay, so, well, thank you so much, Glenn, for joining us this morning. And thank you also to our series sponsor, Highmark Blue Cross Blue Shield, for helping us present this important conversation to our business community. Please visit the partnership.org's event page to register for session 3, where we're really going to focus on communication and information for employees. Thank you for everyone who attended today's session, and we really look forward to continuing our conversation in our final event, which will be held next Friday. So I hope everyone has a wonderful day and the snow melts and we can get back to spring. So thank you again, Glenn, for being with us, and thank you all for attending.